Hi everyone and good evening. Today we have with us a doctor, a renowned cardiologist, cardiothoracic and vascular surgeon with an experience of 23 years. Uh, he undertook surgical research and training at the St. Vincent Hospital, University of South Wales in Sydney, Australia. He is the youngest doctor to have completed his PhD in cardiac surgery from Tamil Nadu State Medical University. He works for Frontier Lifeline Hospital and has an experience in cardiac surgery, pediatric cardiac surgery, and cardiac stem cell therapy. He is the winner of Kendall's Prize for Best Presentation in Cardiac Thoracic Surgery in the Congress of the Royal Australasian College of Surgeons in New Zealand, and many other such awards. He is none other than the son of Padma Shri Dr. K.M. Cherian, who performed the first coronary artery bypass surgery in India. We take immense pleasure in welcoming Dr. Sanjay Cherian to our live with Full House Entertainment today. Hello, Doctor. Good evening. Doctor, I think you've got to turn on your cam.
Yeah. Hi. Can you hear me now?
Yeah, I can hear you, but I think your camera is turned on.
It should come on any minute now.
Yeah, it's back. Yeah.
Hi, everyone. How
Hello.
are you?
Hi, Doctor. Good evening. How are you doing?
I'm good. How are you, Asha?
Yes, I'm really good. Thank you so much for joining us on this live today. And I think this is the best possible time to talk to someone like you and to get some, insights on what's happening around all over the world. I'm sure so many people would love to hear, what are your thoughts and what are your insights on what is happening right now with the COVID-19 situation. I'm sure we would love to get to know a lot many more insights about this and it would be really helpful if you could just brief us or tell us anything that you know so that it'll ease everybody's you know uh, mental whatever disturbance that is going on around right now. You could tell us what you are doing and how you are coping. How is a day at work for you? You could just start off
Sure.
with that. Yeah.
Yeah. First of all, thank you so much for inviting me. It's my pleasure to be here and to connect with all of you through Facebook as well as through Zoom. First of all, I should warn you that I'm a heart surgeon. I'm not a COVID specialist. I'm not a virologist, but I will definitely share with you the little bit of knowledge that we do have.
Yeah.
It's an ongoing process, I guess, because every day we're learning something new about the virus.
Yes.
So I've actually put on a few points together. I've brought it out as a small slideshow, which I will share with all of you. And then
Yeah.
after which we're done, once we're done, we can probably like take some questions as well. Is that
Yeah.
okay?
Yeah, absolutely. Yeah.
Okay. So I'm going to share my screen and let's see if you can see this.
Yeah, I can see your screen. You can start. Yeah, share. Yeah, I can see it now.
Okay, right. So good evening to all of you. And as we all know, we are living in very difficult times now. There's a decrease in the air pollution around us, but still we're all wearing masks. Our roads are empty now, but we're not allowed to drive anymore. People are washing their hands regularly, but we cannot shake hands with each other. Our Mondays have become like Sundays, and our weekends never seem to end. Those who have money have no way to spend it, and those who have no money have no way to earn it. The culprit is all around us. However, this culprit is nowhere to be seen. So, good evening to all of you, and I'll be talking to you about our health and our life during these difficult times. So, I thought I'll divide my talk into four parts. The first part, thought I'll talk a little bit about COVID itself. Next, about the realities of today, a little bit about the do's and don'ts, about the healthcare industry, what we are doing as doctors to try and cope with this dilemma, and the future as we see it and the way forward. So, starting with part one, about the COVID virus itself, it's otherwise called the coronavirus. I'm not going to go into the science behind it because I'm sure my audience is not really interested to hear about it. But What we do know that is that there are lots of theories about the virus, right? We do believe that the virus came from China, it came from Wuhan. There are stories that it could be a natural virus, it could be a new virus, something similar to the SARS virus that we saw many years ago. Some people say that it's a man made virus, it's probably something that they made in a lab. Some people say it's a biological warfare. The fact is, we really don't know. There are lots of theories behind this, but we don't know the actual truth. But the little bit that we do know is that it does spread through air droplets, right? We're talking about droplets, meaning when a person coughs or sneezes, there are droplets which are in the air which can be transmitted to another person. And also through direct contact. So we're talking about if you actually touch a person who is COVID positive or touching the objects that that person had touched. That's another way in which it can spread. There are also theories that it might be in the air itself, last for a long time, but that's quite unclear. What we do know is that it's direct sneezing, coughing, and through objects and through contact. That's what we do know. And the other thing is that this virus, unfortunately, is a pandemic. And when we say pandemic, we're talking about an epidemic which affects the whole world at the same time, right? And this is very similar to the Spanish flu that the world had seen in the early 1990s, like 1918 to 1920. And this had come in a couple of waves. And the first wave of virus came and it killed a lot of people, and then it kind of settled, and after which it came again and it affected more people the second time and the third time. So it took about 2 or 3 years for the Spanish flu to disappear, but it killed about 50 million people at that time. Fortunately, one of the good things about the coronavirus that we're facing now is that although it has infected many people, thousands and thousands of people in India as well as overseas, the good thing is that the death rate following the coronavirus has been quite low. It is only about 2 to 6%, which is quite good. Which means that even if the person does get infected with the virus, there's a high possibility that's more than a 96 or 94 to 98% chance that the person will survive from the virus and live normally after that. And the chances of death, even after you get a viral infection, is only 2 to 6%. So, which is actually a good thing in the long run. So all governments all around the world have at some stage gone in for a lockdown, whether it's a partial lockdown or a complete lockdown of our countries, including India. And what they're trying to do is that they're trying to save mankind. We're trying to get a lockdown. We're trying to prevent the community spread. And we also know that the economy is being hit very badly. All the sectors have been hit, all industries all over the world. So it is a very difficult time for us, but there is some optimism which I would like to share with you. So, as we all know, prevention is better than cure. And we're talking about social distancing, which means you're trying to keep a physical distance between each person, trying to prevent the interaction between people, hence preventing the direct spread of the air droplets between each person. Preventing a community spread, that is what we're trying to do by doing this lockdown. We're trying to prevent people from spreading it into the communities. We're talking about people wearing masks and maintaining good hand hygiene, preventing our hands from touching our face, our nose, eyes, mouth. That's what we're preventing ourselves from doing. So, cleaning our hands regularly, wearing a mask, and keeping a physical distance between others. Now, in terms of treatment options, again, there are lots of treatment options that people have been talking about. Some people have been saying, you know what, there's no point in going for a lockdown. It's better to just go ahead, let the community spread it, and let the person develop their own immunity. And that's what we call as the herd immunity. So some people may die, but in the long run, there'll be like immunity which is spread across the community, which could help people. That's one thought. The other is in terms of a lot of naturopathies and alternative medicines and Ayurveda and Siddha, a lot of them claiming that they do have some form of treatment for COVID, or maybe at least, if not for treatment, at least trying to improve the immunity of the person, thereby trying to prevent these infections from getting really worse. There's also talk about stem cell therapy, uh, taking stem cells out from a person and then injecting it back to improve the immunity of the person. But as we all know, the ideal treatment would be to find a vaccine. Unfortunately, all countries, including India, We're all trying to find a vaccine. Israel, there was breaking news that Israel had found a trial vaccine. Same way, Italy, they said, has kind of found a vaccine. There will be trials which will happen, and after which they will go in for a mass production. And it'll probably take about 6 months to 1 year for the vaccine to actually reach our hands. But in the meantime, all we can do is, keep ourselves as healthy and active and fit as possible till we get a vaccine. That's the ideal treatment. So that's the first part about the virus. I want to share with you about today's reality. What are we all facing today? What we see is most people are working from home, primarily people in the IT sectors, the software sector. These are people who can actually work from home. And going forward, we see that most companies have already decided to allow maybe about 30 to even 50% of their workforce to work from home, and preventing them from coming to work even in the future. Even if the virus is gone, they would still want people to work from home. The other thing is that we see a lot of physical dysfunction. And by this, I'm talking about a lot of people spending a lot of time in front of their screens. So we're talking about increase in their screen time. So it could be a TV, a mobile phone, it could be computers, video games, webinars that people are like attending, like this one now, or online classes. And what I was really surprised to note was that the number of subscribers for Netflix and for Amazon Prime and for Hotstar has gone up by almost 50%. So I guess if you're looking to buy shares in any company, this is probably the best time to buy for them. So the others, in terms of unhealthy food, unhealthy eating habits, we realize that when people are just sitting around not really working, they tend to eat a lot of snacks. You're eating a lot of small bites in between, and you tend to eat a lot of junk food. If you go into the markets these days, into the shops, you realize that most of the chips and the biscuits and all the junk food is actually being sold out. Those counters are completely sold out. So it's a very bad trend. We do see that a lot of junk food is being bought and being consumed during this lockdown period. The other thing is that even people who did go to the gym, they suddenly realize that gyms are closed. It's a good excuse for them not to work out. So there's no real physical exercise happening. So it's a break in their complete routine. So people are getting lazy, couch potatoes, like this gentleman that you can see here with his remote in hand. So people are getting a little more lethargic, just sitting at home, not really working. What we also see is that alcohol consumption has actually increased. Although there's been a complete lockdown in terms of liquor sales, we do realize that some of the states, when they had just opened out their liquor sales, the consumption and the sales of alcohol had just completely skyrocketed. So alcohol consumption has increased quite a bit. Although the stock is less, the consumption has increased. The other thing is smoking has increased as well. It could probably be because of the stress, the anxiety. People want to vent out their anxiety in some way, so they tend to smoke a lot more. They have a lot more time to smoke, a lot of opportunity to smoke. So I guess smoking definitely has increased, which again is not a good sign. And the other is in terms of in addition to the physical dysfunction, the mental dysfunction which is happening. So primarily with kids, especially a lot of boredom, because they're bored after a while watching TV, playing video games. After a while, they're getting bored. It's the same thing holds good for adults as well. They're getting bored. The other thing is agitation. They're getting annoyed sitting at home, sitting within four walls the whole time. So they're really getting angry, annoyed, anxiety, worried about the future. What is going to happen to my business? What's going to happen to my salaries? I'm not working. How do I support my family? So, a lot of worries in terms of about the future. Anger meltdowns, especially with like couples living in close proximities for a very long period of time. So, a lot of anger meltdowns, and also a lot of sleep deprivation, because people are tending to have like short naps in between. Probably a short nap in the morning, late morning, or late afternoon, again in the evening. So they don't have a good sleep cycle, especially at night. So, having said that, how is the healthcare industry coping with the whole problem? What we see is that most hospitals have actually closed down for elective procedures. So I'm talking about elective surgical procedures, and I'm also talking about outpatient procedures. So most of the hospitals are just taking in emergency procedures. Only if the patient is really sick and really warrants a procedure, only then will they do it. Most of the elective procedures are being postponed, And we're hoping that the lockdown gets called off sometime soon so that we can slowly start calling our elective patients slowly in a phased manner to start treating them as well. And even when the patients do come in, they're all being screened. They're screened for their temperature and taking a history. And if there is any symptoms of a cold or cough or fever, anything on those lines, we always make it a point that we screen them and we test them. We test all the patients to make sure that they're COVID negative, and only then will they take them in for any procedures. And the same thing holds good for any staff as well. If there is any staff who's found to have any symptoms, we quarantine them. So whether it's a patient or the staff, we make sure we quarantine them and we test them. And only if they're found to be like negative, only then do they come back into the system. So this is what is being covered by most hospitals everywhere. And despite all this, we do take something called as the universal precaution. So even if the person is found to be negative, even if the patient is negative, we do two sets of testing. And if both tests are negative, even if they say it's negative, we still go ahead and take a universal precaution. So we wear something called as the hazmat gown, which is basically a personal protection equipment. It's very, very uncomfortable. Trust me, I've worn it a couple of times when I did my surgery. And it's like two layers of totally impermeable plastic all around you. So there's no way that any material can come in nor go out. So we tend to sweat a lot when we're inside. So it's definitely not the most comfortable dress to be wearing, but these are difficult times, and when you have desperate times, you do need to have desperate measures. So we do take care, and we are very, very careful in terms of this universal precaution for all doctors and nurses and all the paramedical staff, anyone who's coming in contact with any patient. So, my advice would be if you do have any COVID symptoms as a patient, if you do have symptoms, so primarily we're talking of cough or cold or fever or feeling fluish, which means you're having a generalized body ache, feeling very tired, could be anything. Some of the patients come in these days even without any symptoms at all. Some of them may have vomiting or diarrhea or any of these feelings of ill feeling. Please consult a doctor. Okay, it's always best to quarantine yourself at home. And if you do have symptoms which you feel are getting worse, please come to the hospital. Come, go to any doctor, and show yourself, and they will actually examine you. They will test you and see if you're COVID positive or not. For patients who have other diseases, regular diseases like heart disease or kidney or ortho problems or diabetic, any of these patients who need a routine review, nothing related to COVID, but just a routine review of your existing diseases, then we would say, okay, fix an appointment once the lockdown is called off, and you can go in and see your doctor accordingly. Having said this, despite all our precautionary measures, it's very unfortunate that many of the healthcare workers have been affected. Many of them got infected and they became very sick. Some of them went onto the ventilator. Some of them actually even died. I would like to share with you just as one unfortunate news was when one of the doctors actually passed away, having treated a lot of patients with COVID. And unfortunately, the public, they had a very wrong notion. They had a very wrong understanding about the virus. And they felt that if they take the body out, he's going to be a source of infection. So the mob came out and they attacked the ambulance and they attacked the people around him, and they didn't allow the body to get buried. And then the police had to intervene, and it was a very bad story. So I just wanted to share with you this experience. This is something which is very unfortunate. uh, as doctors, as healthcare workers, we all go out of our way to help our patients. And just a word of advice to patients: please do not behave this way. It's very disheartening when patients behave this way with doctors. So I just wanted to clarify once again that the virus needs an active live host to be surviving itself. So once a person dies, the virus does not spread from the dead body. So please don't worry about that. Please do not, you know, prevent patients from getting buried. It's not going to affect you in any way. Remember, this could happen to any one of us. It could happen to you, it could happen to me, it could happen to any of our near and dear ones. So please do not behave this way. Please be considerate to all the staff, and I'm talking about on behalf of all the healthcare workers, the police, the sanitary workers, anyone who's like going out there and helping the COVID patients. Please be considerate towards them. So what can we do about this? As we always said, when we have challenges, we need to convert these challenges into opportunities. The first and most important point is that you need to have a positive mindset. There's no point worrying about where we are, what is going to happen, because we're all in the same boat. There's no point worrying about it. Let's be positive, let's think positive, behave positively, and see as to what can be done. Now, everyone talks about social distancing. Now, I quite disagree with the terminology of social distancing because I personally believe that what we're talking about is physical distancing, but this is probably the best time to actually connect. So, there might be some friend, some old relative that you've actually lost touch with. This is probably the best time to pick up the phone, give them a call. So it could be a phone call, it could be a Skype, it could be Zoom, it could be anything. Just try, because every time in the past, we've always said that we don't have time. That's the reason why I didn't call. That's the reason why I didn't message. So God has given us an opportunity. This is probably the best time for us to connect with others. So rather than social distancing, I would say we should be physically distancing each other, but at the same time being socially connected with each other. The other thing I would suggest is to reduce your screen time. So limit the time in front of the TV, maybe a couple of hours. Try and stay away from too much of news about the coronavirus itself because it creates a lot of anxiety. Because I know some people who keep watching the news 24/7 and they're like constantly looking at the total number of cases in the world, the total number of cases in the city, the total number of cases in India. It is not going to change. There's nothing that you and I can do that is going to prevent these numbers from exploding. We do realize that the numbers are increasing in India and in our state as well. But at the same time, there's no point worrying too much about it. You're taking too much of anxiety by seeing too much of news on the TV. So I would suggest please stay away from too much of news about COVID. It's not good for you. And also limit the gadget time, especially for kids. Try and keep them away from too much of video games and movies and computer games stuff because we need to try and keep them more connected with the family. So I guess we all have hobbies which we have given up at some stage because of our busy lifestyles. So I guess this again is a good time for us to indulge in our hobbies that we missed out on. So it could be reading, or music, or dance, painting, baking, which I know many people have started taking up, and gardening. So it's not just a way of connecting with your old hobbies that you missed out on. It's also a way of relaxing. It's also a way of bonding with the family and friends around you. So, as I told you, this is probably the best time to bond with the family, and especially for people who have kids, it's probably the best time to involve children in household activities. So, a little bit of cleaning, washing, cooking, or gardening, reading them a bedtime story. This again is something which really helps kids to connect with parents, and it's also probably a very good time for us to dig out our old family photo albums and probably to help kids to actually identify relatives. Because today what's happening is in nuclear families, most of the kids don't know their extended family members at all. So it's probably a good time now to bring out those old photo albums and actually show them what you look like when you were a kid and show them what grandparents and granduncles and all look like. So, bonding with the family, this is probably the best way to relax yourself and also to go through this difficult time. The other thing is in terms of staying fit and active. I know it's very difficult to motivate yourself to exercise. Many people who were going to the gym where they completely stopped the routine. So I guess if you exercise as a family, it's easier to motivate each other. Maybe some form of sports. It could be like just badminton or soccer or something. You can just kick a ball around um, just in your backyard on the terrace, in the balcony, something that you can just, do something to be active. With smaller kids, probably like a small catching game or like a skipping game or something like that, which can keep you active. A little bit of yoga, if you're into yoga, deep breathing exercises definitely help, and maybe even just a little bit of stretching exercises, so it helps you to be a bit more flexible and active. I would say probably one of the easiest ways to remember this is to unite with the four elements of the world. As we all know, when you look at the world as a whole, there are four elements. We're talking about wind, fire, earth, and water. So, water, as we know, constitutes majority of our body. So it's very important to stay well hydrated, and we're talking about fresh juices, water, and to avoid anything like aerated drinks and alcohol in as much as possible. So just stay as hydrated as possible. So water is the first element. The second thing is earth. So we're talking about the food which goes into us. So we're talking about having more fresh fruits and vegetables and nuts, and to avoid junk as much as possible. So try and cook fresh foods at home, and try and have raw fruits and vegetables as much as you can. So the third element is we're talking about air. So it's important to go out and to get some fresh air. I know you're not allowed to go out too much, so you can probably just go for a quick walk around your park if you have a small joggers park in your compound or a garden. Just just go out and get some fresh air, and also some simple breathing exercises. As I mentioned, people who do yoga, some deep breathing exercise can definitely help. And the fourth element is fire, and by which I mean stay optimistic, avoid fear, stay away from anxiety, and spread the fire of joy and optimism around you. So these are the four elements that I want to talk to you about. So coming to the last stage in terms of the future, moving forward, many people have a lot of questions about the COVID. Is it going to come back? Is it going to stay forever? When is this going to leave us? One thing I want you to know is that this virus is definitely something new, and we don't know too much about it. So we are not very sure as to how long this virus is actually going to be around. So even if the lockdown has been called off, chances are that the virus is still going to be there. So we need to always be careful. The other thing is what we do know from history is that viral infections always come in waves. As I mentioned about the Spanish flu earlier, it came in about two or three waves, and it actually lingered around for about 2 to 3 years. So we can be absolutely sure that this coronavirus that we are seeing today will probably go off now if you're lucky, God's grace, if everything goes well, it will leave. But it's highly possible that it'll come again. It'll probably come back by the end of this year, probably by September, October, around that time, by the end of the year, or by early next year. So we should be prepared for it. Um, but as I told you, it could disappear, but it surely can reappear at a later date. So we need to be prepared, and we need to be like aware of the fact that it can come. So what I'm trying to say is that don't be surprised if suddenly the COVID-19 disappears and tomorrow we have a Corona 2.0 version which will like reappear. And just like how Arnold Schwarzenegger came back with Terminator and he said, I'll be back. So don't be surprised, we might have a Corona 2.0 tomorrow. So what do we do in the future? So the best thing would be to avoid crowded places. We're talking about large malls and markets where people tend to congregate a lot. So even if you do have to go, probably we'll have to like cover ourselves well. Avoid going to cinemas too much, crowded cinemas, large weddings, carnivals, etc. So this is something which we need to probably keep in mind even after the lockdown. Masks may become mandatory tomorrow, and for all you know, it might become a fashion accessory. So just like people wearing watches and fancy shoes and bags, we already know that Louis Vuitton and Burberry and even Victoria's Secret has like started coming out with fancy masks. So it might probably be a good investment for you to invest in a good mask now, because this might be part of our fashion tomorrow. So, in summary, what I'd like to say is eat and drink healthy, right? So, we do know that we need to boost up our immunity. And the only way we can do this is by eating and drinking healthy, by staying fit and active. And we're talking about some form of exercise to make sure that we keep ourselves healthy. So, if we eat well and we drink healthy and we exercise, we'll be able to boost our immunity. And that's what we're trying to do now until we get our vaccine. And most of all, it's the best time for us to enjoy time with our family, and it's a good time for us to have to ourselves, to relax, go back to our hobbies, and learn that people, unfortunately, many people think that work is life. They believe that everything they do revolves around work. We need to realize that there is much more to life than just work. We need to spend time with family, we need to relax, and we need to enjoy ourselves because we don't know as to how long we're going to be around. So it's important that we are happy and we live healthy. So in closing, I'd just like to say think positive, stay safe, and stay healthy. Thank you very much.
Thank you so much, Doctor. I think you can. Okay. Yeah, your screen share has gone back. Can you hear me? I'm back on.
Yes, I can.
Yeah.
Yes.
Okay, thank you so much. That was really insightful, and actually some of the things that you said, when it particularly comes from say a doctor, people are like more likely to follow it rather than just reading it off the screen or like listening to people say things like exercise and drink more water. When it actually comes from a doctor, they are more likely to actually follow through some of these things. Um, so I mean, under the video on Facebook, there are quite a few comments and questions. If so, I can ask you those, and probably we can
Sure,
discuss that. Is
sure,
that
sure we
fine?
can.
Okay.
Sure.
So one of the questions is that in Chennai, so are we having uh, testing centers in all private hospitals? I mean, other private hospitals or only in government hospitals? And are private hospitals admitting patients as well, like
Yes.
for quarantining and for taking for treatment?
It's a good question. Yes. Initially, when we started,
Yeah.
it was only government hospitals that were allowed to admit patients, and it was
Okay.
only government hospitals that were allowed to test patients.
Yeah.
Now, soon the government realized that they were being flooded with patients that they were like unable to handle it. So they realized that it is important that they get the private sector involved as well. So you can test in private labs. There are private hospitals as well, and there are also private hospitals that are admitting patients
Okay.
and treating them. So there is a list of I think about at least about 10, 15 centers that have been identified. So there
Okay.
are several hospitals in the city and in the state that are not just testing but also treating COVID patients.
Okay. Right. So that list was initially released, but we were not sure if people were actually, you know, going to these hospitals, because all the numbers that were coming up in the news and everything were actually coming from government hospitals. So people were quite confused whether, the private hospitals are also taking in patients and treating them as well.
Yeah, yeah,
Yeah.
yeah.
Okay. The next question is Chennai equipped to handle a huge increase of cases? Like, what do you think? Because Chennai does seem to be on an exponential kind of a curve as compared to other cities in India, uh, along with a few other cities actually. But what do you think? Like, would this increase continue to increase in Chennai, and is Chennai equipped to handle this?
Right. One thing is the we have not our curve has not flattened as yet. We're still on an exponential growth. As you
Yeah.
can see, the numbers are increasing every day, and in hundreds. It's not. It's like 400 yesterday. It's 500 today. It's 600 tomorrow. So the numbers are increasing, no doubt. And at the same time, in terms of are we equipped? Uh, I don't think anyone really is equipped completely. I don't think any country or any city, for that matter, is fully equipped. Um, because if you look at all the ventilators and all the beds put together, uh, in both in the private sector as well as in the government sector, all of them combined together, we wouldn't have the numbers. So that's the reason why the government is looking to contain the infection as much as possible by going in for a lockdown and preventing people from going out and spreading the infection or getting the infection themselves. So, no, I don't think any city, for that matter, even whether it's New York or whether it's London or Chennai, I don't think any city is actually equipped or ready to handle that kind of a load. Because even if you look at Chennai as a city, I think we have a population of more than 1 crore people in just Chennai, and we don't have 1 crore beds in Chennai. we'd be lucky if we have more than maybe even about maybe what 10,000 beds. If we have 10,000 beds, I would be happy. But I don't think we have the numbers. And I'm not talking about just Chennai. I'm not trying to find fault with Chennai or with Tamil Nadu. I'm just saying that this is the reality
Yeah,
which we all have to face. So no city on this planet is fully equipped to handle the complete population.
right. Okay. Uh, the next thing is so there are these talks about herd immunity that is going the rise, so where people are saying for a country like India, which has such a huge population, the only way to come out of this is to just let a lot of people get affected by the coronavirus. So what is the logic behind herd immunity actually? Like, I mean, some people are for it, some people are like, how can we let that happen? Because we do have people with low immunity and aging parents and grandparents, and how can we let that happen? So what is the logic behind herd immunity? Does the
Yeah.
yeah
The
does
logic
the
is that we're allowing people in the community to get infected, uh, and after a while, people will start developing an immunity for it. And once the immunity is built up within the system, that kind of spreads through the entire herd, meaning the entire community. This is something which they found in herds. That's why we call it as herd immunity. Um, and no doubt, the risk in that is that you will lose a lot of people. You lose a
yeah,
lot of patients who would probably not be able to come out of the infection. At the same time, there might be a significant number of people who will develop immunity to this. As I told you in my talk, that the number of deaths from COVID has been quite low. It's been about 3 to 6%, which is quite good. And India, despite all the infections and in spite of the exponential growth that we're seeing, we still realize that the number of deaths that we see in India is much lower when compared to the Western countries. Uh, so herd immunity probably is not the best way to go. The best way to go would be to find the vaccine and to treat the patient with the vaccine. But as I told you, the vaccine is going to take some time. So the only real bet that we have at the moment is to stay safe and stay healthy until and unless we get the vaccine in hand.
okay, right. So if we have the vaccine, like would that be kind of like the end of this? Like, would I mean, even if there's a relapse or even if COVID comes back again, so like to COVID 2.0, so I mean, would the
Yeah.
vaccine be sort of like the end to this? I mean, can we go to malls and cinema theaters and everything after that?
Yeah. See, this is what happened again when we talk about tuberculosis, right? We have the
Yeah,
BCG vaccine, we have smallpox, we have polio. See, these are vaccines that we have for certain diseases which in the early days killed millions of people. Smallpox killed,
yeah,
eradicated, population like crazy. I mean, like they
yeah,
killed a lot of people.
yeah.
Finally, we eradicated smallpox. Smallpox is
Mhm.
not around anymore. At the same time, if you look at polio, polio used to kill a lot of people. Finally, we got the oral polio vaccine, and that is part of the regular vaccination for children these days. As a result of which, polio is almost not seen these days now. So
Okay,
we're hoping that if we do get a vaccine for the coronavirus, we're hoping that once we get the vaccine, it's tried and tested, we give it to the entire population, and then this would probably become part of the regular vaccination schedule, just like how we would get a tetanus and a BCG and an oral polio vaccine. We'd probably also just get a vaccine which is mandatory and given to everyone, including kids. That's
right.
probably what happened. Now, again about Corona 2.0, the question is, will it come again? And when it comes again, how will it react? Will it be the same? And the vaccine that we are going to produce and administer today, will it be active against the Corona 2.0? We don't know because one thing about viruses and organisms, bacteria, is that they all tend to mutate with time, which means they will change their characteristics. Their DNA will actually evolve and they may become worse with time. So we don't know. So we have to take one step at a time. So at the moment, what we do know is that this is something which is contagious. It can spread very easily. It can kill a few people. So at the moment, we don't have a vaccine. So we need to stay home. We need to stay safe. We need to be physically distancing each other from each other. So that's all we can actually do at the moment. Now, if we are going to start talking too much about the future, I don't think it's too right, because we honestly don't know where
Yeah.
we're going. The future is
Okay.
quite good at the moment.
Right. Okay. Um, so people are so there's a lot of talk about Ayurveda and Siddha and homeopathy, uh, claiming to be preventive or probably even curing. And even in Chennai, I think that some of these medicines are being distributed. Correct me if I'm wrong, but what is your take on these medicines? Like, do you think it could have some role to play uh, in this
Yeah.
picture?
Yeah. So I haven't personally tried it myself, so I can't really comment on that. But then I do know of many people who have tried it. Uh, I don't think it's promoted as a cure, whether it's allopathic medicines or Ayurveda or Siddha, Unani, any naturopathy. I don't think it is propagated as of now as a form of treatment, but I think it's being propagated as a form of boosting your immunity. Hence, you're preventing that infection from coming in. People are also trying different things like steam inhalations, gargling. These are things that you can do. I'm not saying that it's going to kill the virus completely, but you can
Right.
probably prevent it from coming, and you can prevent other infections from coming in. Steaming is something. Steam inhalation is something which many people do, including myself.
Okay.
Again, it's something that we just do because we feel that it's going to improve our system in some way. So again, all these alternative medicines, I think they boost your immunity. I think so. I really cannot vouch for it, but I think that's what they are trying to do.
Okay. So, with regards to the future, right? So, wearing a mask, like you said, it's probably going to be part of the future, at least for some time now. So, are you saying wearing a mask does protect us, like to a decent extent? I don't know the percentage. You can probably talk about the percentage. How much does it protect? And
I'm sorry, Varsha, I'm not able to hear
I mean,
you. You're cutting off your audio.
hello, hello. Is it clear now? Hello, hello, hello. No,
Varsha,
not
I'm sorry,
yet.
I'm not able to hear you. Your connection's down.
Uh,
You're cutting off in between. I can't hear you. I'm so sorry.
Hello, 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 hello,
Yes, hello. Can you hear me?
hello. Can you hear me? No.
Hello.
Hello.
Can you hear me?
Hello. Hello.
Yes. Can you hear me?
Hello. Yeah, I can hear you. Can you hear me?
Yes, yes.
Oh, okay. Right. Yeah. So what I was asking was, so you said that wearing a mask is kind of like the future, like it's going to be a fashion statement going forward, right? So do you think wearing a mask does protect us to a great deal? And can we be confident that if I'm wearing a mask, that then I actually won't get the virus? I mean, obviously, along with washing hands, probably when you come back home after, say, a grocery trip, how much do we have to wash everything? Like at my house, we're washing, literally everything. We're washing the plastic covers that we, buy vegetables in. We're washing vegetables itself. We don't buy anything that we cannot wash. Like say spinach is off the list because we cannot wash it and keep it outside for a day. So I mean, what is the extent to which we need to take precautions? Like, does wearing a mask and washing our hands and probably just washing our clothes and the basic level of precautions enough, and to keep us safe? And yeah, obviously avoiding crowded places. But yeah, is that enough? Do you think?
In terms of the mask, wearing the mask is not going to completely prevent the infection, but it has two uses. One thing is, if you're infected, it prevents your infection from going out. And at the
Okay.
same time, if the other person's wearing the mask as well, the chance, if the person is not infected, the chance of him receiving that droplet infection is also decreased. So it's
Right.
important that if you are infected or if you're not infected, you should still wear it. So that's why many countries in Western Europe, especially like Norway, Sweden, uh, they realized that they were able to bring down the numbers quite quickly. Although there was like a burst in many countries, they were able to contain it quite fast. So I think masks will definitely help. Again, I'm not saying that it's a foolproof method. There is no point in everyone walking around with N95 masks. Even if you're just wearing a regular mask, wear it wherever you go out. And see, certain countries like Japan, for example, they have been wearing masks for a very long time, even before this virus came in. This is part of their culture. They always, almost always,
Okay.
wore masks in Japan, and also when they traveled outside. If you see a Japanese tourist, when they, even if you see a Japanese tourist in the US, even 5 years back, they would still be wearing a mask. It was part of their culture. So
Yeah.
masks definitely will help, but I'm not saying that it's going to completely stop the virus. It decreases the spread, but doesn't stop it. In terms of washing, your question was about washing things. Yes, it's always better to wash. We don't know whether it's how long is it going to be staying on a vegetable. We don't know, or on a plastic wrapper. We really don't know. So we are all trying to be safe. We do it religiously in most houses. We wash hands. Yes,
Yeah.
washing hands is very important. You need to wash for at least about 20 to 30 seconds. Plenty of soap, all your surfaces, uh, above and below, between the fingers. That's very important. And
Okay.
washing whatever you can wash. Yeah, vegetables or fruits. Leave them in the sun for a while. We do know that the virus is not going to stay on for very long. So even if you wash it really well, if it's something which is coming in a plastic wrapper, try and wash it and leave it in the sun for like a couple of hours. I think that should be good enough. Uh, Very rarely do we hear about someone who actually caught a viral infection by eating something. It's, as I told you, most of the time it is droplet infection. And even if you look at the recent numbers that were going up in our markets here, it is primarily because of overcrowding. People were like,
Yeah.
just not obeying social distancing norms at all. So they were like in a hurry to buy food, as a result of which they didn't care about social distancing, and that's the reason why. So I don't think it actually got spread through the vegetable or through the fruit.
Yeah.
I think it was more through the actual physical contact with the other person.
Okay. Right. So the other question is with regards to people who are already sick with, some other terminal illnesses or any other, ailments that we have. So are they getting, I mean, are they being admitted to hospitals? I mean, how is it for people who have any other illness, say at home, and probably they are feeling some symptoms and they want to go and get it checked? Are they able to go to private hospitals, get themselves checked, or all of that is like closed as of now?
As I told you, if it is a patient who is suspecting COVID, if there is a patient at home who feels that yes, there is cough, cold, fever, and I'm starting to fall sick, yes, you can go to a hospital. You can go to a government hospital or to a private hospital. You can get yourself checked. There are testing kits available. You can test yourself, and after which, if you are found to be positive, yes, they will quarantine you usually for a period of about 14 days, and they will give you medications, and then after which, most of the time, as I told you, you'll be able to come out of it. Yes, so if there are symptoms, you should definitely go to the hospital. And
Okay,
all
so this is
hospitals
for
are,
the
most hospitals, government hospitals, and several private hospitals are admitting patients.
Okay, so this is for the COVID side of things. So what my question was basically for, say you're having a stomach ache, say
Non,
for, yeah, not
if a
COVID. Yeah,
non-COVID,
so are people correct? Yeah, so are
yeah.
people
So
still allowed to go to hospitals and get themselves checked? Like for a very long time they're having, say stomach upset or something else like a knee pain or a back pain. I don't know, any other ailment which is kind of chronic and which is not going away. They want to go and get themselves tested for checked with, checked with a
yeah,
doctor. Are
yeah.
those things open and is that easily accessible for people right now?
Right. So, as we mentioned again in my talk, most of the elective procedures and most of the elective consultations in the outpatients department have been closed. But nevertheless, having said that, you will have access to your doctors. So, you can call the hospital or you can call your doctor, talk to them, And based on the severity of the disease, now if you've been having, as you said, a stomach upset which is just not settling, or you have been having this knee pain which is really getting worse, yes, then you can fix an appointment, maybe a tele consultation to
Okay.
start with, and after which, if they can probably examine you, just look at the knee, for example, if there's pain or swelling, and then based on which they can say, hey, listen, you can probably try these medications, because now most of the pharmacies are even accepting prescriptions which are just photographs, and we can probably write out a prescription for you. We can take a photograph, send it through WhatsApp. That is something which is acceptable by most pharmacies even now.
Okay.
So that's something which can be done. And even after that, if things are not getting better, you feel that your symptoms are not improving or you're getting worse, yes, you can fix an appointment with your doctor. You can go and see them. Ideally, probably better to wait for the lockdown to settle if that is possible. But if you feel that your symptoms are not improving, yes, you can go to the doctor.
Okay. Right. Okay. And I think there's just one last question, which is with regards to kids. So there are different opinions about how kids are being affected by the COVID, right? Across the world, there are some places where kindergartens are opening up earlier, and schools are opening up earlier, but there are some places where kids are getting affected more. So what is your view on kids and how they are getting affected or they're not? Like what age or how can they be safe from this?
Right. See, the same precautions that we are taking as adults, the same things that we should be following for kids as well. What we do know about the virus again is that it tends to be more virulent in the extremes of ages. So in kids, in like people who are, I'm talking about kids who are like 10 years and below, and people who are like 60 years, 70 years and above. They're the ones who are more prone for infections, because probably the immunity is not as strong when you're too small, or when you're too old. That's when the immunity is not so strong. So we need to be very careful with them. So again, social distancing as much as possible. I mean, sorry, not social distancing, physical distancing as much as possible, and washing hands, teaching them the importance of washing hands as much as possible, and yeah, just keeping them healthy and active, and giving them healthy foods, because we need to boost their immunity. So try and keep them away from crowded places, even moving forward, uh, even after the virus so-called disappears, and even after the lockdown is called off. uh, Try and avoid going to places that are very crowded, because this is going to be a shift in our paradigm. The way we think, the way we behave is going to change, and this is going to be the new normal for us. So the new normal will be to avoid going to crowded places. Washing hands is going to be normal. Wearing a mask is probably going to be normal. So that's going to be the shift in paradigm, which we
Okay.
should be all prepared for, including the kids.
Okay. This is one other question which someone has asked, and they are asking: Is vitamin C a valid supplement to boost the immunity?
Yeah, vitamin C is a very good immunity booster. It definitely helps to prevent infections, especially the common cold. It's definitely effective. So I personally recommend not taking the tablet itself, vitamin C. I would prefer you to have a glass of lime juice every day, or eat an orange every day, because that's a natural source of vitamin C. So I definitely recommend
Okay.
vitamin C. It's definitely useful. Yes, it helps to improve your immunity.
Okay. Right. Okay. I think we have someone joining us on the call, and she has a question for you. Linda,
Sure.
are you here?
Yes, yeah, I'm here. Can you hear
Yeah.
me okay?
Hello,
So,
no.
so percentage wise, what is the percentage of asymptomatic people versus those that are showing strong effects?
Right. That's a good question. Um, Trends are changing, because earlier most patients that we saw were primarily coming in with some form of symptoms, usually with a cold, cough, or fever, myalgia, body ache. That's what we saw initially. Now, and symptomatic patients, any of these symptoms, most of the patients, I would say at least about 60 to 70% of patients came in with some form of symptom. Some of them initially didn't present with obvious symptoms, but they had a strong history of travel. But now, these days, we don't see a history of, hear about a history of travel anymore. Asymptomatic patients are slowly creeping up now because earlier there were probably about maybe about 5 or 10% of patients who were totally asymptomatic. But now we see that about maybe about say 20 to 30% of people who are coming in do not really have symptoms. So this is a worrying trend that we're seeing now because more and more patients are becoming asymptomatic carriers, and they're difficult to identify in the community. So they're just sometimes just found by screening. So that is definitely a worry that we're seeing now. There is a shift more towards asymptomatic carriers.
Thank you.
Okay, you're welcome.
Uh, okay, there are, I think, a couple more questions. One is there some self-test that we can do at home to know whether we are affected, like anything to check
Not
your
that I'm
breathing or something?
Not really. I don't think there is any self-test as such.
Okay,
But if you do feel feverish, it's always better to have a small thermometer at home and just
okay,
record your temperature. If you feel feverish, check your temperature. And if you feel that you're starting to develop a cold, cough, fever, and starting a runny nose, these are things that we should look out for. But I don't think there's one specific self-test that you can do.
okay. And the asymptomatic patients that you mentioned, right? So are they remaining asymptomatic throughout? Like they never develop symptoms at all? Is that what you're saying?
Not that they don't develop symptoms at all. They do develop symptoms later on, uh, but they remain asymptomatic for a very long
For
period
a
of
very
time.
long,
Yeah, and
right?
then they suddenly end up having. We had seen a couple of patients in the recent past where, not us personally, but we had heard about it and also read about it, where there were some patients who came in with almost no symptoms at all, and then they started developing symptoms in a very short period of time, and they became very breathless. They had very bad cough and fever, and when they were tested, they were found to be positive, and within a couple of days they deteriorated very rapidly.
Right.
So that it doesn't mean that an asymptomatic patient is forever going to remain asymptomatic. He will start developing symptoms at some stage, uh,
Okay.
but not probably in the early stages. Yeah.
Right. And what is, are you seeing any trend of relapse, which is basically people who were positive, they turn negative, and then they're turning positive again after, say, a while?
I think we're still a little too early on the curve, especially in India. I think we are seeing a few relapses happening in countries like China and other countries which were on a downward, who had actually flattened on the curve and who were like starting to go down on the curve. And they realized that some of them are starting to relapse again. So I think in India, we're a little too early to talk about relapses because we're still on the exponential upward growth still. We haven't flattened our curve as yet.
Right. Okay. I think this is the most uncertain time that anyone can go through, and it literally teaches philosophy, I guess, to people that what
Absolutely.
philosophy's real truth is, which is life is uncertain.
Ab-
So I think there's nothing else to do but to just be positive and just move on with what we can do rather than trying to control anything at all because everything seems pretty uncertain with respect to this virus, right?
Absolutely, absolutely. Very
Yeah,
difficult times that we're all going through. And it's not like a storm. You read about there was an earthquake in Japan, there was a storm in Philippines, there was a fire in Australia. It's not like that anymore. We are all in the same boat at the same time. It doesn't matter whether you're a rich person in the US or you're a poor person in Africa or you're like living in India. It doesn't make a difference because it has affected the entire country, the entire world. It doesn't look at the rich or the poor. It has affected absolutely everyone. Everyone's economy is being hit. Every industry has been hit. So
yeah,
it's a very difficult time that we're going through, and it's very uncertain times as well because we still don't know what we're actually fighting against, and that's a
yeah,
fact. So, what is most important is that we have to stay optimistic. Don't give up hope. Be optimistic. Be glad. Be happy that you're alive today and you have the things that you have today. Be positive. Think about your family. Think about spending time for yourself and for the people around you because these are things that uh, the world took away from us because of work. Many people were so involved with work that they just had no time for anything. And I think God and I think I guess the world just decided saying that, you know what, it's time to stop. It's time to hit a reset button and go back and think about what is actually important in life.
Yeah, absolutely. Yeah. Is there anything else you want to say, doctor, like to the people?
That's about it. I think
That's about it.
I've bored everyone enough for today. So
No, no, no,
but
absolutely. I think it was the most informative session, and coming from a doctor, like I cannot stress that enough. Like I'm sure it tells people to actually let go and not be so paranoid because it really is uncertain and we cannot do much about it. No matter how much of information that we try to gather or how much of news that we try to consume, this is just going to be this way, and it's going to be the new normal. So thank you so much for joining and all of your insight and for clearing up so much of our doubts, actually. Thank you so much. It was a pleasure talking to you.
thank you so much. My pleasure too. Thank you.
Thank you. Good evening.